welcome to Pet Paul Vision channel. This channel is maintained by Prof Dr. Amalendu Chakraborti. As per demand and desire of the pet-loving people of society, this channel is launched for various aspects of pet care management.
Good evening viewers. Today I am going to discuss on urinary tract problem in dog. You see, urinary tract means UTI problem in dog. In case of human being, it is very common. In case of female, this problem is very common. But in dog also, they suffer from urinary tract problem. If you consider urinary tract consists of a pair of kidneys, ureters, urinary bladder, and urethra. This urinary tract has many functions. Most important is filtering the blood toxins, maintenance of electrolyte balance, and reabsorbing of water for the body. Urine is created as a waste byproduct and it has to be thrown away. Kidney, besides all these functions, kidney also produces a hormone known as erythropoietin, which helps in the production of blood cells. So erythropoiesis is being done with the help of a hormone that is known as erythropoietin. Now let us discuss about the various problems which generally occur in dog. First is urinary tract infection. Infection in the urinary tract. Then if you come to the bladder, there may be cystitis or other problems, but at the same time most important is urolithiasis. That means stones in the bladder. Stone may be big or stone may be very small or granular. If it is granular, medicine may help, but if it is larger, in that case surgical intervention is necessary. Then kidney is very important, that we will discuss separately. Then we have got bladder itself, there may be cystitis. At the same time, bladder cancer may also occur in certain dogs. Then disease of the prostate gland. This is very, very important. I tell you, in case of human being, male used to suffer from prostate because they have got the gland. And the prostate problem is very common, and there may be prostate cancer also. Then maybe Cushing's disease, then maybe diabetes mellitus. That may also have interactions with the urinary tract. And infections, urinary tract infections, it may cause straining while urinating. Blood may be voided from the bladder to urethra, and it is caused by different type of bacteria. And urinary tract infection may occur secondary to urine crystals. If there is crystals, in that cases, the granules may rupture the capillaries of the bladder and thereby blood may ooze. And this is also very painful. And if the infection is there, in that cases, dogs with urinary bladder infection will drink more water. This matter has to be monitored. One thing I tell you, when we suffer from any urinary tract infection, at the time there is very problem in micturition. So people used to advise us that you should take more water. But dog also knows that I am suffering from urinary bladder problem, or UTI problem, therefore I have to consume more water. So dog itself take more water while they suffer from urinary bladder infection. So this is also one of the signs that people will come to the doctor and say, doctor, you see my dog is taking more water. So we'll have to find out why it is taking more water. It may take more water in case of other diseases also, but one of the diseases is urinary tract infection. Some dogs strain to urinate And when you urinate, blood comes out through the urine. Sometimes bladder is involved without infection. We consider them as sterile cystitis. Mostly inflammatory cystitis, but here there is no infection, but cystitis is there, so we call sterile cystitis. Then important point is stone. Stone is very common and very frequent, because nowadays what happens, I tell you, owner used to keep the dog and go to the service. So plenty of water is not there. Therefore the animal cannot get adequate water. If it does not get adequate water, there is chance of formation of stones or urolithiasis. Stone in the urinary bladder. Initially you may not noticed, but finally when it is not in a position to urinate or urinate few drops of urine only with much straining, so it indicates that there is some obstruction. That means some stone is there. Sometimes if it goes more pressure, bladder may be ruptured also. Dog may die due to septicemic shock. And when there is stone formation, immediately it imbibes the bacteria. So there is infection also. Urine will fall in the abdominal cavity and dog will die. Dog, while living with urinary stone, will continue to strain to pass urine, but in vain. Alkaline pH help in the formation of stone. If you can give some acidic preparation, so some stones may be dissolved. Then I am coming to bladder cancer. In this case, affected dog will continue to strain to pass urine, may pass small volume of urine, and most common cancer is the transitional cell carcinoma. The urinary bladder cell is we call transitional cell. So there is transitional cell carcinoma. There may be urinary incontinence. Here the dog involuntarily loses control of bladder, so urine dribbles. It is a medical condition. That means without its will, dog passes the urine or dribbles the urine. Then why this happens? Why this urinary tract infection happens? I tell you, your actually cervix remains closed throughout the year, but it opens at the time of parturition and at the time of season. At the time of period or season, whatever you call heat. So during heat, cervix is open. So at that time, one has to keep much attention or hygienic attention, otherwise bacteria may enter. So urinary infection is one of the important cause, and infection is generally, E. coli is very important offender. Besides the other organisms like Proteus, Staphylococcus, Streptococcus, etc. may also intervene. So urinary infection, urinary tract infection, anatomic abnormalities, weak bladder muscles, the muscles of the atonic muscles. So in that case the urine cannot pass. Weak bladder muscles, spinal injuries or degenerative changes. I tell you, if the spinal cord is somehow damaged or some tumor is formed in the spinal cord, in that case that animal will not be in a position to defecate and urinate. That will be a problem. Then hormonal imbalance, prostate disorder, this is also very important. Prostatic disorder, then vulvovaginal stenosis, urethral sphincter mechanism, low estrogen level may cause weak muscles. If the estrogen level is less, so contraction will be less. And at the same time, diabetes mellitus. Diabetes is a disease which actually affect very many organs in the latter stage of diabetes. Then there will be kidney disease, Cushing's disease. Here the dog will drink too much water, excess corticosteroid, here also it will take water more. urinary calculi, and tumor. These are the causes for which urinary tract infection takes place. All dog owners therefore must have to look whether his dog is drinking adequate amount of water or not. That means urination and defecation is proper or not. If it is inadequate, there is problem. If it is adequate or more excess, there is also a problem. Here, mostly inadequate. Defecation is problematic. If the prostate is enlarged, defecation will be problematic. Most common signs of urinary tissue is related to the amount of water consumed, too much or too little, and the abnormal urinary pattern, and staining while urinating, and small or large volume of blood also come out, and the dog may lick penis. So these are the problem. And if you want to diagnose such cases, that means whether there is UTI infection or not, so then we will have to think of color and turbidity. Color may be reddish, red, or turbidity means turbidity means you're not clear, not transparent, it's translucent, and we'll have to do the complete blood count. If you make the complete blood count, you can have indications of whether there is infective or non-infective in nature. Disease is infection or infective disease or non-infective disease. That can be find out through CBC. Then you can make routine urine analysis. If you make the routine urine analysis, you can know of the pH, you can know of the specific gravity, you can know of the other contents, and at the same time caste, pus cell, etc. you can get out of urine examination. You call urine routine examination. Then we can make urine culture and sensitivity test. If you get the organism, or if you think that there may be some organism there, in that case we can isolate the organisms, make antibody test or antibiotic test, or we call antibiogram. Antibiogram will help you to make the proper treatment of the condition. Then you can go for radiology or you can go for USG depending on the condition, depending on the situation. I tell you, since it is a broad, I am discussing on a broad-based problem. In that case, according to the etiology, treatment has to be done. If it is bacterial infection, we'll have to go for antibacterial agent. If it is due to hormonal function, then we'll have to go for supplementation of hormone. And if it is a tumor, then we need surgical intervention. And if we think that the pH of the urine is altered due to food, then we'll have to, nature of food has to be changed, diet has to be changed. And if you want to prevent such cases, in that cases I tell you, mostly breeds, age and size, that is very important. I tell you, above 4 years, the problem arises most. And some problems are mostly in female. UTI problem is mostly in abundance in female animal rather than the male animal. In male animal, urethritis, stone formation, kidney problem, or your prostate problem may arise in case of male, but in case of female, those things will not arise. Then treatment, I have already told you, depending on the cause, you will have to go for treatment. And most important thing is hygienic diet, maintenance of hygiene, and lifestyle modification. This is very important. Suppose your dog wants to urinate and the owner is not going it to outside, going it to take outside for urination. In that case, the urine will be retained. If the urine is retained for a long time, in that case, there is possibility of bacterial infection. Or sometimes there may be rupture in urinary bladder if it is retained for a prolonged period of time. Then medicinal treatment is almost important. I already have discussed about that. And if nothing is happened, that means there is dribbling of urine or incontinence from urine, then we will have to take some measure so that the bed or the floor is not soiled. In that case, we can use doggy diapers or walking the dog more frequently outside so that it can urinate, or using waterproof pads under the bedding, just like what we do in case of our children. In that way, we can prevent or manage the problem. And finally, what I can suggest that maintenance of proper hygiene is very, very important point, and the skin infection has to be stopped, because from the skin the bacteria or the germ may enter in the urinary tract. So in this way, this is an overall picture of UTI infection in dog. The dog owner is advised to take proper precaution, proper hygienic measures and proper diet so that the animal remains healthy and we can avoid this UTI infection in future. Thank you.